Malaria is a disease of the poor, and in Southeast Asia it's often a disease of the dispossessed or the stateless, migrants, people who don't appear and don't want to appear. There's no one knocking on the doors of intervention to save them. So it differs from most other medical problems, in fact, and it really has a very small public voice. So it's our responsibility in the malaria community, the greater malaria community, to act on behalf of these people, and if necessary to bang on the table and to demand the right things are done.
ตั้งแต่เมื่อเพิ่นไข่หันเพิ่นมาแต่เบิดมาแต่ปลาไปกับหมู่หากจะไปปลาตัวใดว่าไปไหม้ไปตอกนั่นแหละมาแล้วก็มาว่าบ่ได้ขายว่าไข่เด้อไข่จังซั่นแล้วก็หมู่เพิ่นเอาหมู่มานำหมู่ไปนำกันน่ะมานอนอยู่นี้มานอนก็เลยไข่แล้วหมู่เพิ่นเมื่อแล้วก็ถ้าร้อนมันไข่อยู่บ่ว่าซั่นแม่ใหญ่ถามยังไข่แบบเขาจะได้สิมีเงินบ่มีเงินก็เอาเงินนี่คนที่รู้โตหันเรืองมาก็มาแม่มาเห็นเลยว่าขั้นหมูขางัวขาสร้างจะสิกินได้ลูกเรายาจะสิกินไรเจ้าไข่มาสนาบอกเลย
ก็ว่ามื้อนั้นหันคุณพรรษาแล้วว่าแม่เอ้ยว่าเอากับน้องนั่นเฮือนดินหาอ้ายลูกอ้ายมาเมียนะเอาอยู่ได้แม่สิ้นเพิ่นว่าสิละอยากเฮ็ดได้แล้วเพิ่นว่าสิละเอา2,500อีพ่อของบ่ได้กินน้ำดอกว่าซั่นมันน้อยโอ้บ่กินก็ยาลูกเอ้ยกินแล้วก็อยากกินเด้อลาวขอเลยว่าสิแหละ
มานข้าวนึงมาเว้าให้เอาบักนี่กับปีนี่จักเอานี่มันหายนี่
จอกคันแม่ขาดแล้ว
ให้เอานี่ให้เอาลูกนี่
ไปทั้งเมียไปนอน
เนี่ยก็เอานี่ก็เอามันนี่ข่อยสิเบิ่งดอกลูก
In this region, there's also been some pretty remarkable successes in driving down the overall burden of malaria. However, all that's going to be reversed if we don't do something about addressing the problem of drug resistance.
The first time artemisinin-resistant malaria parasites were identified was in Cambodia and in Thailand. However, in the years to come, and also due to intensified drug resistance monitoring, those parasites were identified in further countries, first Vietnam and Myanmar, and very recently the Lao People's Democratic Republic.
Artemisinin resistance is important because it is a global public health emergency. We have seen resistance to anti-malarial drugs in the past emerge from this region and have spread to Africa and beyond. We potentially could be faced with unnecessary deaths. It's critical that we try to mitigate this problem and essentially move to eliminating artemisinin-resistant Plasmodium falciparum malaria.
A few years ago, ended up putting more resources here into the Mekong region because of the emergence of drug resistance and the need to actually do something about it, not only to benefit the health of people in this region, but also, hopefully, to keep whatever's going on in this region from popping up in other parts of the world, particularly in these high-burden countries in Africa. So there is a link here between what we're doing in Africa and what we're doing here in the Mekong.
In Thailand, we're seeing a reduction of malaria cases, but we're also observing increased numbers of malaria hotspots where you can find artemisinin-resistant malaria on the border areas. So what the President Malaria Initiative is doing is they're supporting the Control and Prevention of Malaria project. This CAP Malaria project, we work closely with the Bureau of Vector-Borne Diseases to do primarily increased access to malaria services, particularly at the provincial, district level, and the village level.
Because of the problem of artemisinin resistance, we are tackling mobile and migrant population or some specific ethnic groups in some countries. The main issue is that these people are moving a lot, and it's quite difficult to follow them up. And in order to be sure that they are very compliant with the treatment they was given. So this is an issue. But more and more we are doing action and we are collecting information regarding all this population at risk.
มุ้งก็ซื้อมาเองพอนั่นก็เอาลูกเข้าไปนอนในมุ้งเพราะก็นอนในมุ้งกันหมดนะคะตอนเที่ยงคืนก็ตื่นไปกรีดยางแล้วก็เอาลูกนอนในมุ้งพอป่วยพออะไรก็ไปหาหมอเช็ดตัวไปหาหมอพอไม่หายก็ไปเจาะเลือดที่ศูนย์มาลาเรียนะคะศูนย์มาลาเรียก็อยู่ที่ทับไซลูกโป่งน้ำร้อนเนี่ยค่ะศูนย์มาลาเรียเขาที่รู้ไหมว่ามัน
The location we're in now, in this remote rubber tree plantation, I think represents one of the challenges, one of the greatest challenges we face in eventual elimination of malaria. We must get the right treatments and diagnostics, as well as education, to the point where patients, families need them. And so to do this, we have to find out who these populations are, what their needs are, and really focus on tailoring our interventions for this kind of penetration. By creating the bridges to places that are remote like this, and training village-level community workers to provide malaria services, we're also creating the capacity to address other diseases. By creating the capacity, there's a spillover effect. And eventually our hope is that we will address diseases, not only malaria, but take the perspective of the villager, who after all wants their child taken care of. They want to be well. Even though this is a malaria-specific program, we think there's benefit across the board.
CAP Malaria work closely with all kind of private providers, company, drug outlet, and we train them to register all suspected of malaria patients come to seek their care, because we want them to provide the appropriately diagnosis by using RDT. This is a rapid diagnostic test, and then though private provider who provide diagnosis should record well and share that record of patient file to the public health facility.
ពួកកម្មករពួកខ្ញុំនេះគឺរៀងរាល់ថ្ងៃគឺយើងតែងផ្ដល់ប្រឹក្សាឲ្យពួកគាត់ចឹងគាត់យល់ដឹង
បាទមកតំបន់នេះយើងជាតំបន់ក្រាលខ្លួនចាញ់យើងពេលហូបបាយគឺពេលជាពិសេសពេលយើងធ្វើការយើងពាក់អាវវែងឲ្យខោក៏ចឹងស្រង់ទៅក្រោមការពារបដាមូខាមកជើងក្រោមប្រជាពលរដ្ឋចល័តជាប្រវត្តិស្រុកដោយគាត់ទៅធ្វើចការអីចឹងយើងចែកមុងដើម្បីបង្រៀនពួកគាត់ពីរបៀបចងមុងយ៉ាងម៉េចពេលដែលគាត់ស្នាក់នៅព្រៃហ្នឹងដែលគាត់មកផ្ទះអត់បានហ្នឹងទូកើតទឹកឡើងហ្នឹងទៅគាត់មកអត់បានគាត់ត្រូវការគេងនៅចការគាត់បើគិតថាពីផលប្រយោជន៍ក្រុមហ៊ុនយើងចំណេញថវិកាថាកាលពីមុនយើងមនុស្សតែជាង40នាក់មួយខែយើងអាចប្រើលុយអស់ទៅ2000ទៅ2000ជាងតែឥឡូវនេះរយៈពេល2-3ខែយើងអត់ដែលប្រើលើសេវាហ្នឹងទេនៅតំបន់ខ្ញុំនេះកាលពីដើមខ្ញុំមានតែកម្លាំង41នាក់ទេអញ្ចឹងជួបការលំបាកខ្លាំងដល់ប្រយតំបន់នេះវាជាតំបន់គ្រុនចាញ់ហើយងាយរងគ្រោះបំផុតអញ្ចឹងពេលខ្លះកម្មករខ្ញុំឈឺព្រឹកឡើងមានមួយថ្ងៃ5នាក់16នាក់អញ្ចឹងពេលខ្លះខ្ញុំដឹកទៅមើលទៅមន្ទីរពេទ្យនៅប្រម៉ោយពេលខ្លះយើងអាចដែលគាត់ឈឺធ្ងន់យើងអាចដឹកដល់មន្ទីរពេទ្យខេត្តអញ្ចឹងក្រោយពេលយើងសហការមានគម្រោងកម្ចីមុងពីអង្គការ UOC ដើម្បីយកមកផ្គត់ផ្គង់ឲ្យកម្មករយើងប្រើទាំងអស់ហ្នឹងឥឡូវយើងកាត់បន្ថយរយៈពេល4ខែហ្នឹងយើងអត់មានសូម្បីតែម្នាក់អញ្ចឹងយើងក៏អរគុណដល់ខាងអង្គការដែរដែលបានមានការសហការល្អ
Krawang district is one of the districts in Posat province. CAP Malaria train private providers, and one of the private providers that I visited recently, they give me a lot of impression that private provider play a key role in that area, because that private provider, they see many patients a day, and of them is many patients is malaria, which is impressed. Recently, in just a past 6 months, they see like almost 1,000 of patients suspected.
What I smoke ấy? One. Mình vô đằng bị phun chay khát đây luôn. Ọt đằng bờ kia, đây bị vô này nòm đi mông đi, cà phê đi ọt đây nó. Đằng ta phun rồi một pẹp rồi. ប្រហែលឆ្នាំទៀតអាណារៀនមិននិយាយប៉ុន្តែបើសិនជាជនចូលរួមការយល់ដឹងខ្លាំងអំពីរបៀបវិធីសាស្ត្រការពាររបៀបអីហ្នឹងហើយជាអាចដាច់មកបាទដាច់អាចបាត់បានឲ្យតែការយល់ដឹងរបស់គាត់យល់ណាយើងអាចដូចជាតាមភូមិតាមអីយើងអាសាពយល់ដឹងតាមគាត់យល់ដឹងខ្លាំងគាត់អាចធ្វើបានហើយប៉ុន្តែតាមពិតទៅនៅតាមភូមិមានអ្នកស្ម័គ្រចិត្តភូមិគេនៅជួយខាងហ្នឹងបាទមិនអត់ទេ បាទស៊ីសងការយល់ដឹងរបស់ប្រជាជនផ្ទាល់ទេចូលរួមចំណែកធំមកបានយើងអាចបើយើងធ្វើតែយើងថ្នាក់លើនឹងគាត់អត់នឹងនៅតែដដែលហ្នឹងអត់ងាយដាច់ទេមិនដឹងជាថ្ងៃណាបំបត្តិបានទេខ្ញុំគិតរាល់ថ្ងៃហ្នឹងចឹងគិតចឹងបាទ
In Battambang province, Cap Malaria trained taxi driver who bring passenger from town to the countryside where the malaria endemic areas are. While driving, taxi drivers talks and show the video to their passenger about malaria health education and health seeking behavior.
មីងធ្លាប់មើល spot សាប់ផ្សាយនេះមានឃើញនេះឥឡូវបើក្នុងទូរគេផ្សព្វផ្សាយពីជំងឺគ្រុនចាញ់ហ្នឹងជាមួយរៃគោលមីងមូរៃគោលនេះវាខាំច្រើននៅពេលប្រលប់ទល់ព្រលឹម នៅថ្ងៃពេលមូរៃគោលយីវាមិនសូវចេញទេមីងច្រើនតែពេល